I wrote a book called Ben Oni Le Benjamin From Sorrow to Strength My Journey with Depression. And I really think when I learned about solution focused therapy or solution focused brief therapy, I realized that it fit in a lot with my theory of change and the idea that you can learn from your struggles and use the skills and the strengths you learned from your struggles to be able to cope with other challenges that come your way. So it's not saying that challenges make you stronger and therefore they're good. I never liked that idea, but it does say that we all face different struggles and we learn from the struggles and we can use that to help us cope with what's going on in our life right now. That's kind of a simplistic idea of what solution focused brief therapy is, but it's a strength based method which focuses on solutions, not problems. And the goal is really to shift one's perspective to one of hope and positive expectation for change. Change is really seen as constant and unavoidable, and it begins with what's already working, what you've already done well. And it's focused on the future, not the past. So the past is focused on in the sense of how have you used the past in the past to cope with challenges and how you can use what you've done in the past to help now. But it doesn't really delve deep into past history, attachment theory, family, trauma, anything like that. It really focuses on the future and how to create solutions to the future. It also emphasizes that change doesn't have to be a massive transformation. It's just the smallest steps, little steps moving forward can make a big difference and can lead to change. So for example, if you're using a scaling question, you can say, client says they're at an 8, the therapist can ask, how can you get to an 8.5? So it's these little small increments. And it's thought of as a modality that doesn't focus on feelings or emotions, which is not exactly accurate. The goal is not to have positive emotions because emotions are seen as transitory, but the positive emotions that are elicited from therapy can be used to create change. For example, the therapy, because it is strength-based, client-focused, the client being the expert, it's very empowering and it creates a sense of hope and purpose. And those positive feelings of hope and purpose can lead to finding solutions for change, which can lead to greater long-term change and not just an emotional change. Solution focused therapy works very well with different cultures. It's a social constructionist theory. So the truths are not universal, but it's dependent on perspective. And this goes with the idea of solution focused therapy, which says that the client is the expert in his own experience. And if the client's the expert, then regardless of culture and what I as a therapist might say should be the goal, that doesn't matter what I as a therapist said. It's what the perspective of the client is. And I think that that's a really important aspect of the therapy. It's also in the sense of compliments. When you compliment the client, it's based on what they would find complimentary, not necessarily what the therapist would find complimentary. And I've kind of jumped around a little bit because I didn't talk about interventions. I mentioned them. So I'm going to just mention a couple of the interventions that are used. One is the exception question. So if somebody comes in and says that they can never get out of bed, you might ask them, well, what did a day that you could get out of bed look like? That could be an exception question. You didn't get out of bed 9 out of 10 days. Okay, what did that 10th day look like when you were able to get out of bed? Also, recognizing the solution. How were you able to cope with a similar situation in the past? how can you use those strengths that you've used now to help cope with your situation? There's scaling questions. So on a scale of 1 to 10, how confident are you that you can maintain this change? On a scale of 1 to 10, where are you now on your solution or your therapy? On a scale of 1 to 10, what has on a 10, what has been your best day ever? A 0, what has been your worst day ever? That's a different kind of scaling, but that can also be used. Another intervention that's used is the miracle question. And the miracle question is a really important aspect of solution-focused brief therapy because it helps define what the goals are. And it's often a question that does have to be adapted based on culture and ability. So, for example, for somebody with intellectual disabilities, which solution-focused brief therapy has worked really well with, the miracle question might have to be adapted a little bit. Miracle question focuses on the future. For some cultures that aren't necessarily future-oriented, it can be adjusted a little bit. But basically, the idea of the miracle question is asking your client, if you were to fall asleep and wake up in the morning and all your problems were solved, how would you know? What would it look like? And it wants to be discussed in a positive way, not I wouldn't be depressed anymore, or I wouldn't be unhappy, or I wouldn't be fearful. It would be, you'd go deeper into, well, what does it mean to not be fearful? What would you feel instead? So you really want to kind of focus the goals on a positive, not the absence of a feeling. And it is a very important question, and it seems simple, but it's actually pretty complex to ask and for the client to understand. So you kind of adapt it to the client and how that works. I do like, again, solution-focused brief therapy because it works with so many different, diverse clients, not just culturally, like I said, but people of different abilities, because it really focuses on, instead of what the caregiver wants to see fixed, which is often done in cases with people with disabilities, is the therapy is what's wrong with the client, how can we fix the client, especially how can we fix the client so it's not as difficult for the caregiver to help them. And with solution-focused brief therapy, it asks the client, what do you want to work on? What do you think you need help with to fix? And I'm putting fix in quotes, but it's asked in a way that they understand. And it's really focusing on what they want, recognizing that they're the expert. And in doing so, it really empowers them to make change. And the caregiver is present during the session so that they can understand what might happen in between sessions to kind of continue if there's homework or anything that needs to continue to be done, as well as sometimes the therapist may need to explain to the caregiver a little bit of in detail something the client might not understand, or the caregiver might have to explain something to the therapist that the therapist doesn't understand about the client. So it's just very helpful to have the caregiver there. When I say caregiver, it could be professional, it could be family members. It hasn't been done with teachers, but that is probably an option as well. And I like this because I have actually worked with people with intellectual disabilities and would like to continue to work with them. And I'm, glad to know that this can be used for that. I've also worked with people with dementia, and I like that. Even though there haven't been studies on how to work with people with mild cognitive disability, it's probably very similar to intellectual disability or mild to moderate intellectual disability. So I really like the idea that I can continue to serve underserved populations. And I've been able to use this with my clients in a residential treatment center. It's worked really well. For example, the miracle question, I was focusing on a client about reuniting with his family. Initially, that's what we thought he wanted. And then when I asked the miracle question, his family didn't appear in that picture that he saw. And I explored it further and realized that maybe that's not a goal of his right now. So might have been something I thought was important, but it wasn't important to him. So it allowed us to clarify what the real goals are. So ultimately, I think that it really aligns with my beliefs, my values, and goals. And I like that it's adaptable. And I don't know if I'll always use solution focused brief therapy, but for right now, it's a really good modality to start with. And it's a good modality, I think, for beginner therapists as well, because it's a little bit more clear cut and easier to use.